Okay, block.
Good evening, Namaskar, Adab. Warm welcome to India's premier #1 digital simulcast. Every day, we try and bring you up to speed with exactly what is the story as far as the war on Corona, as far as the battle against Corona is concerned. And this is a broadcast which you all know goes simultaneously live across all our social media platforms. We're live as we speak on Facebook. We're live right now as we speak on Periscope, on YouTube. So you can follow this broadcast on any of our channels. And each day, we try and explain to you, along with some experts like we have today, Dr. Tripti Gilada, who's joining us from Mumbai. Warm welcome, Doctor. Hope you're safe and sound, healthy.
Yes, as of now, so far so good.
Lovely, lovely, lovely. It's good to see you smiling. You know, I miss smiling faces these days because there's so much of cynicism and pessimism all around us now. But I'm hoping that things will improve as we go along. What we want to do today is that we want to do a very, very straight, critical analysis, a critical take on where have we reached in this battle against Corona. We're really entering a critical phase, I feel. What we are being told by various analysis, by various estimates is that we have somehow managed to beat the Western world when it comes to this question of how many people have tested positive, or for that matter, how many human lives have been lost. Today, I want you all to look at two facts, folks. And if you're watching this broadcast on your devices, I want you to quickly go onto another device and Google this fact: asymptomatic factor versus symptomatic factor. Asymptomatic factor basically means that you, or I for that matter, we may be carriers of this virus, but we may not know. We may not know that we are carriers. Our immunity system may be better off, and therefore we may manage to deal with it. But when it comes to, well, you dealing with it, maybe your immunity system is not that good. Dr. Swapnil Parikh is joining us live as well. Good evening and welcome, Swapnil. Hope you can hear us.
I'm just trying to get my earphones on. Give me one second.
Sure. No problem. I'm just going to mute you for a moment, and we'll come back to you. We got lots of data points, and we want Dr. Tripti and we want Dr. Swapnil to help us understand where we really are as far as this fight against Corona is concerned. We also hope to be joined by an iconic name in global media. Jim Clancy had promised me that he will be live with us in another half an hour time from now. I'm hoping that you're watching this broadcast, and Jim is going to be joining us live from the United States of America to help us understand what's the link between what is going on in India and what's going on. What are the lessons that India can take from the United States of America? So first up, let's play the first slide, and let's first understand what is the story which is being told to us. This is the story which is being told to us. Each day there is a new graphic. This is coming from Shamika Ravi. Shamika has been on our program earlier. She's from the Brookings Institution. Now this viewpoint is accepted across the board by various stakeholders, that you are testing more. As we speak, you are literally testing up to 320,000 samples, total of 320,000 samples that have been tested so far. And what are we saying? We're saying confirmed cases per 100 tests. Per 100 people who are being tested, on an average of a total number of tests that have been conducted, which is roughly 320,000, we're talking about 4.2 people testing positive. 335,000 is the total number of cases which has been tested. So 335,000 total number of cases tested. 4.2 is the success rate, is the number of people who are testing positive. Now, where does this leave us as far as the rate of doubling of these cases is concerned? Again, a lot was made out that have we managed to flatten the curve? Simply because, well, more and more as we go along each day, more people are now managing to deal with this virus. So 335,000 versus 4.2, the number of positive cases. Let's look at the second slide then. And let's look at exactly how the second slide impacts public opinion. Because on this program, to you, Swapnil, and to you, Dr. Tripti, what we want to do is we want to strictly go by the data, and we want our viewers to know whether we are in a better spot or we're not in a better spot. Now, again, this is also coming via Shamika Ravi, and this is her data. She puts up good data, but her data is based on active cases based on the number of tests which have been done so far. So what we are being told now is this, that as far as your growth rate in last 5 days is concerned, which is at 7.1%, so 7.1% is the overall number of growth. In terms of the number of people who are testing positive, cases are now doubling every 10 days. If we say that cases are doubling every 10 days, Dr. Swapnil, I straight away want to begin with you. And I want you to respond to this graphic which we are playing right now. Do I take this graphic and do I say that actually the state, our country, because this is the overall India number, that we've actually managed to deal quite well with this virus? If the number of days which is being taken in terms of doubling of the cases is almost 10.
Well, so no matter how well we respond, we're always going to be one step behind this virus. And that's something important to remember. If we started running right at the onset of this outbreak in China, we would still be behind this virus, several steps behind this virus. And in many ways, this virus is going to do to the world what it wants to do. Unfortunately, this is what you do see with exponential growth. You see like, this is exactly the curve you need to look at. You need to look at the rate of change of the number of cases, the increase in the number of cases. And again, the important thing we need to point out here is this is the increase in the number of confirmed positive cases, not in the number of new daily infections. That might be several folds higher. So a recent study came out, not study, but reports from a US aircraft carrier or a destroyer where there was an outbreak. And up to 60% of the people tested were asymptomatic at the time of testing. Some of these will remain asymptomatic. Some of them will later go on to develop disease. But that's the point. The asymptomatic and pre-symptomatic cases can be as high as 60%. So that whole chain of transmission is invisible.
That is my fear. Swapnil, that is my fear. You know, and I just wanted to hold on for a moment because very special guest is also joining us, and I was talking about this. Jim Clancy, iconic name in the world of journalism, was with CNN. Now he's he's on his own, and Jim has been busy tweeting away and giving us a sense of what is happening in America. Jim, what a great pleasure to have you on the show today. Jim, warm welcome. I hope you can hear me loud and clear.
I can hear you now. How are you today?
Very well, Jim. I want to thank you firstly for taking time out, and it was nice to reach out to you on Twitter and get this immediate response from you. Jim, I have two doctors with me as well, and I'm trying to understand the link between India's response vis-a-vis the American response. And just at the time when you came in, Jim, we were trying to understand whether India is struggling exactly the same way as the Chinese did at one point, or maybe the Americans did it at a later stage, which is to make the distinction between the number of symptomatic cases and asymptomatic cases. Where is the American story, Jim, as far as testing of all American citizens is concerned?
It's getting better, but it's nowhere close to where it needs to be. You know, I think most people know that all of us are learning from one another, from our experiences trying to address coronavirus. We are trying to figure out ways how to best protect lives, how to treat people, that elusive search for a vaccine that we know could now be a year away, maybe more. All of these things we're learning from one another. And I think that the asymptomatic cases is a real cause for concern. So too are the cases where someone recovers from the virus and then tests positive again. We don't understand this virus. We do know that it's highly communicable and it's a risk to us all.
If it is highly communicable, and without doubt, we've just put this graphic up, and I'm sure you can see this. You know, in America, as of 11th of April, the total number of cases, the total number of tests which were being done was 97,173 daily cases. I'm sure that figure must have gone up in this last week. In India, as of 17th of April, we were doing 31,080 cases. How does one look at this fight between the developing world and the developed world, Jim? What does India learn from America?
Well, to be prepared and to plan on these pandemics, this is easily the biggest news story in decades. And as all of us look at it, when we look at the testing numbers, the US, the White House proudly pointed to tens of thousands of tests being done. And, you know, some of the senators in the US Congress who really are up on the subject and who have proposed detailed plans. And here I'm speaking about Elizabeth Warren, saying we don't need tens of thousands of tests. We need tens of millions. And given the population in India, I think that that's good advice as well. You need a test that is, number one, going to confirm that someone is positive for COVID-19. But number two, also, have they built up immunity to this virus? Those are both different tests that we have to somehow arrive at for everyone possible. I would argue that the tests that are being done now they're testing individuals they already suspect have COVID-19. And they're just in the United States, just trying to clear that to make sure that that's a positive case specifically for this virus and not another flu virus, a cold virus, or something like that. That's all useful, but that doesn't get us anywhere in terms of bringing people back into the workspaces and letting their coworkers know that, you know, they're not positive, they're not going to get the disease. And these are really important things. But we need so much more testing to be able to answer that, to reopen our economies. That's the goal.
Yeah, sure. I think the economic lockdown, and again, I think there are a lot of, there is lots to learn for India from the approach which has been shown by Donald Trump or vice versa. And I will talk to you in a moment on that, Jim. But I just want to bring in Dr. Tripti as well, who's there in Mumbai. Doctor, look at what Jim Clancy is saying. And I take that point completely, that we need to do far more testing. Absolutely no doubt about that. Let's specifically look at the state of Maharashtra. And we'll put that graphic up. In terms of what is happening in Maharashtra, overall number of positive cases, and overall number of asymptomatic cases. Somewhere, this battle against corona, I think, is veering very quickly to in this direction. That do we know exactly how many asymptomatic cases are there? Now look at this. In Maharashtra, what is the total number of tests which has been conducted? Total number of tests which has been conducted till the 18th of April, 60,166. Population of Mumbai, 1.8 crore. That's what we're talking about. Over 1 billion people, 1.8 crore. And what is of great interest to me, and I think something which needs to be looked at very closely, Dr. Tripti, is the number of people who are asymptomatic. 63%. 63% of people who've tested positive in the state of Maharashtra are all asymptomatic cases. Therefore, I ask you, Dr. Tripti, on one hand now, if I take that first graphic that I played, where we said that, well, it's now the number of the cases, the frequency of doubling of cases is now, well, every 10 days in comparison to total number of asymptomatic cases. Does that first slide really give you an accurate picture of how the situation is then?
I completely agree with all three of you that we are really not testing enough. And we know that over the last few weeks, we've learned, and there have been several studies and several papers, that most of the positive testing people are asymptomatic. Why we probably are seeing a delay in doubling numbers is because we're still in lockdown. And that's one thing that we need to understand, is that we thought that lockdown would be one single strategy and we will win this battle. But that's not true. Lockdown was to give us enough time to set up everything straight while social distancing was happening, but get our testing protocols, our testing infrastructure ramped up, our healthcare system ramped up. And I think we haven't still got it all ramped up. If you see the figures, US tests around over 10,000 per million.
Right.
And India tests around 250 per million. Even Pakistan tests 400 per million. So we are like one of the countries that is really not testing enough. And this asymptomatic carriers or asymptomatic cases is indeed worrying, because we need to understand that at this point, while the entire country is locked down, in fact, it's important to understand where were these asymptomatic people found from. So most of these asymptomatic cases were contacts of someone who was tested positive. So they brought in contacts, they tested them, and they found that, oh, they're positive, but they're asymptomatic, and they were all isolated. But as soon as the lockdown is lifted, we are going to have a lot of asymptomatic cases out in the public who will be transmitting the infection. And that is something that we all know. And that is when we will actually start seeing a rise in cases, in asymptomatic, not just asymptomatic cases, but symptomatic cases and also critical cases. And that is something we really fear after lockdown. And that's the reason why we have another 2 weeks. We really need to ramp up our testing. There is just no escape from testing. ICMR says sometimes that we test enough. We should just accept it. If we don't have enough kits, let's say we don't have enough kits, but let's not say that we're testing enough.
I think what's happening, and Jim, I want to bring you back in this one. I think in India, what's happening is that we are simply going by the fact that either it's the temperatures or maybe, well, we just seem to have better immunity and all kinds of things are being spoken about. Jim, I want you to weigh in on this Boston Consulting Group report, which was recently released. And it makes a very strong argument about the extent to which lockdown in India will go. Please tell me the American economy, the extent of social distancing, which was being spoken about, the offices and the commercial establishments being locked down. In America, what kind of a hit has the American economy taken because of this coronavirus?
Well, to give you an example, 50%, more than 50% of everyone in Los Angeles, and that includes Hollywood, are unemployed. They're not working. Now, we told these workers to go home, but we've got an unemployment figure that keeps rising and rising. And there are many industries, there are many companies that are really struggling now. The restaurants, the bars, these other things that are now just shut down. They can do takeout, delivery, but that's nothing. That won't support them. They need people inside, in seats, and they can't do it right now. We've had, these bailout programs, but, when you see thousands of people lining up at a food bank in Houston, and you realize that hedge fund managers, these so-called captains of the universe, they got millions in bailout funds. And for what? I mean, they knew they were taking risks in the stock market. Why are we bailing them out? And then ordinary people, ordinary Americans aren't getting the help they need. And that's going to hurt the economy long term. Wall Street isn't going to evade the consequences of all of this if Main Street shuts down.
If that's the scenario, that you're building up in America, I really am scared, Jim, to put your arguments in the context of what's happening in India. Because what's happening in India is this. Look at what was being stated in the epidemic scenarios. The fear is being expressed is that we expect the lockdown to be lifted between the 4th week of June and the 2nd week of September. I mean, if I think of a lockdown which goes till July, I think the Indian economy will just end up being finished. What kind of a global impact do you foresee, Jim, in terms of what we are witnessing right now?
I think it's dangerous to make predictions, but it's going to be dire. It's going to affect all of us unless there's a vaccine, unless there's a drug that can successfully treat this coronavirus and help people to recover more rapidly, give more protection to the most vulnerable people with weakened immune systems, the elderly and others. I think the economic consequences are going to be horrendous. Entire industries are going to change. Some of them aren't coming back. South African Airways report today saying the best airline in all of Africa is going under and it's not coming back. These are the things that are going to be permanently changed. There's positive things as well. Working remotely I knew that there were video editors working for various major networks in the United States. They had an experiment with 3 of them and it had been ongoing. Well, guess what? Suddenly they've got 200 people and they have no choice but to have them editing at remote workstations. And now the corporations are looking at that and saying that could change our financial bottom line because we don't need the office space, the expensive office space if we can have workers doing this job successfully from home. So we're going to see a lot of changes, both positive and negative, and there's going to be untold pain.
Oh no, I couldn't agree more with you, Jim. I mean, look at this. You know, I'm sitting in my residence, and Dr. Parekh is at his residence, and you're there in America, and you know, Dr. Tripti is there. On another day, you know, maybe we would have worked out some OB-WAN or some satellite link for you. But here we can do all this via the internet. So why can't you do this for the rest of the 365 days? But Dr. Swapnil, let me come to you. From what I understand now very clearly, this scenario which has been predicted by Jim Clancy, and I have absolutely no reason not to go by what he's saying. Please tell me, is a simple solution for India? A simple solution to India is somehow to figure a way out in which we can do more testing. What could be that solution?
So on the 7th of April, I proposed a solution to the government of India, and it's based on hard evidence. You know, it's easy to say that we need to ramp up testing, but you have to remember there's a critical shortage of reagent, of kits worldwide. These tests are expensive, and I work extensively with the BMC, so I can tell you in Mumbai and the Maharashtra government, and I can tell you they're trying everything they possibly can to scale up testing. It's a difficult challenge to solve. So what we suggested, and you know, I think this is it's going through, the WHO has sent a team of experts to do this, is repurposing what's known as the polio wastewater surveillance program. So as you can see on this graphic, you know, the SARS-CoV-2 virus is secreted into the stools, is excreted into stools.
Yeah,
and when this sewage goes to a main treatment plant, you can test for it there. And then you can, you know, if you show the other graphic with the pipes, I'll kind of explain the process. But you can trace the infection back to a hotspot using what's known as a RT-qPCR by checking for the level of viremia in the samples. And this gives you a community surveillance program. And the important part is this program is already battle tested in India for polio. So, you know, the people who have done, it's like 90% of the system is already there. We need to repurpose it. And this is going to allow us to test, well, surveil the community at large using a quantitative assay. And I think we need to look for innovative solutions like this, because just saying test more, when, you know, we have to remember we sit in our houses and sometimes we forget that India is a very, very poor country. I mean, there are people starving right now without food. The government has a lot of problems to look at. So of course we need to test more, but just saying test more without proposing actual ways that we can scale that isn't helpful. This is one of the ways, you know, we can scale that. In the other graphic, you'll see that, let's imagine a city like Mumbai. It has a main sewage treatment plant. So you can take a sample, do an RT-qPCR on that, and then you can follow the pipes back to the hotspot and do intensive individual testing there. This methodology is already proven in the Netherlands. And the amazing thing about this is it addresses what you were concerned about, the asymptomatic and pre-symptomatic individuals. You see, when you test individuals based on symptoms, you miss a lot of people. But when you test the community's sewage, even the people who are asymptomatic and pre-symptomatic are excreting the virus in their stools. So you can detect it. And in fact, in Amsterdam, a city in the Netherlands, they detected the virus in the sewage, I think 3 to 5 days before the onset of the first case in the community. So that's quite remarkable, right? It just gives you that added lead time. And every day that you detect earlier, that's infection that you stop from spreading. So I think this is going to be a game changer for India. There are other solutions that we've proposed, and you know, of course, other people have proposed like multi-pooled PCR. So there are innovative ways to save reagent, optimize costs. Another thing that we just proposed to the BMC is that instead of letting every lab buy their reagent individually, what happens is the large labs can order a large quantity and get a good price, but the small labs have to spend a lot more. So what the government can do is allow CSR organizations, companies that are doing CSR work, to donate money into a CSR fund, buy kits, and then distribute those kits at a subsidized rate because they're buying in bulk to all the different labs and pass the saving on to the consumer. So that would reduce the price by about 15-20%. Doing pooled PCR would save about 30% of reagent. So, you know, we have to reduce the inefficiencies in the system. You need to make sure that every lab is running at 100% capacity. So let's say a city like Mumbai, which has a lot of PCR labs, and then let's say Nagpur has only one. whatever extra capacity Mumbai has, you need to set up a transport mechanism so that no test in Nagpur or Pune is kept waiting. And no lab in Mumbai is running empty. So there are optimizations that you can do. There are efficiencies you can get rid of. I think that's what we need to look at. We need to take like a startup approach to this problem. And as part of the startup approach to the problem.
I agree with you. I agree with you. Let me just request Tripti to hold on for a moment, because I want to specifically look at something of more interest and more concern, I think, with Jim. Jim, let's look at the strategic aspect, the global aspect of what's going on. I mean, I can tell you in India, and our producers will play this press release, which has just been issued by the government, that now there is a policy framework which is being created, which will make it very difficult for Chinese companies to acquire businesses in India. Do you think China is in danger of becoming some kind of a global pariah from, being a leader of global supply chains? Is China in danger of becoming a global pariah?
There's no question that China has been hurt by all of this. And Chinese economists are looking very closely at the case studies. At the same time, China's diplomats are going around the world handing out face masks, doing what they can to create some goodwill. A lot of leaders, including our own President Trump, are trying to find a scapegoat. It's not my fault. Politicians, this is common. They want someone to blame, and China well knows they could be the one. So, the WHO has been singled out by President Trump, even though many of his advisors have been, before this, praising the WHO. And the WHO has provided so much key help and resources around the world that, it's hard to imagine how we would function without it. China, though, it remains, for the first time, its growth has suddenly turned negative. And this is a sobering moment for the Chinese Communist Party as they try to deal with this. They've got a lockdown on political power, but in order to hold on to that, they still have to maintain their position in the world. Can they recover that? Are there going to be people who say, you know what, I don't want my supply chain going through China for these core essential goods. I want to have them based in my own country so that I can control them. And I don't want the Chinese in one way or another controlling aspects of my economy by buying into the industries that really support that economy. All these questions are being asked. Do we have the answers? No. But we can say in a general sense that China's going to take a hit. How severe will it be? A lot of people are looking at it and saying, yes, it was the world's factory floor. It was the cheapest place to get manufacturing done. But suddenly, it's not looking so cheap.
Yeah, if it's not looking so cheap, and there are lots of comments which are coming on my Facebook page. Arun Pratap Singh is saying this: China cannot escape its share of blame. And I was looking at videos, Jim, which were showing how in Australia, people were getting upset with right outside the Chinese embassy. There is a fear factor which exists on minds of various top Indian corporates that I'm speaking to, that there could well be a scenario where big democracies, whether it's America or India, with our close linkages to China, we may well, for some time, be forced to look for supply chains elsewhere. In that kind of a scenario, what do you think happens to economies like America or economies like India?
Well, I think that they go through some, fundamental changes. I mean, this is a matter of the bottom line. When corporations saw that they could create more profits by outsourcing work to China, Indonesia, other places where labor is cheaper, they seized upon it to increase their profits. Now it doesn't look so cheap. They're having to pay high prices. There's middlemen everywhere. And so there's I think a push by some to bring some of those jobs back to their home countries and to look at it like these are core things that we need. The whole effect of all of this is going to be that we're going to have a changed economy. COVID-19 is changing us in medical ways, economic ways, business pattern ways, all of these things together. And you know what? that may be a very good thing.
I think so. I think if people are being forced to look for options and look for solutions elsewhere, I take that point. But also throw some light, Jim, on the fact that, given the fact that America goes to elections, and the fact that there is this bitter, ugly war which is taking place between the Republicans and the Democrats, and Donald Trump, being Donald Trump, never misses an opportunity to score points over his rivals. How is this entire COVID battle actually impacting political preferences in large parts of America? Jim? I think we've just there is some audio connection. We'll come back. We'll come back to
famously.
Jim.
Yeah, he wants.
Go ahead, Jim. Go ahead.
Could you hear what I was just saying?
No, I just missed it. If you could just start your answer again. Yeah.
All right. Well, let me just say that President Trump still has his political base. I think the most recent numbers were somewhere around 65% of Americans without a college degree still strongly support the president.
Good. Where are you from? Where are you from?
I'm from Taiwan.
Good.
Yes. On behalf of foreign media group.
Please go ahead.
Thank you very much, Mr. President. We know many people around the world.
Yes.
Press conference. So,
Where are you from? Where are you from?
I'm from Taiwan.
Good.
Yes. On behalf of foreign media group.
Please go ahead.
Thank you very much, Mr. President. We know many people around the world are paying close attention to this
Yes.
press conference. So
Yes.
on behalf of
Good. Where are you
foreign
from?
media.
Where are you from?
I'm from Taiwan.
Good.
Yes. On behalf of foreign.
So Donald Trump loves to get into a fight with journalists. So let's keep that aside. But you think is Trump's hold consolidating in parts of America, or are people beginning to feel that maybe we expected better from our president?
Well, there's a lot of people, obviously, that think that we deserve better from the president. He has bungled it. He just, weeks before he was saying there was no virus, it was a hoax, this was the flu, it would all go away. People aren't stupid. They see that he did that. But his core supporters are still there. And if Democrats want to make a comeback from all of this, they need to register more people to vote. Only 50% of Americans typically vote. And fully 30% of them aren't even registered to vote. I mean, those who qualify, they could vote, but they didn't even bother to register. And so they have a real problem here, and it has to be addressed. Vote by mail may be the best way forward. At least many Democrats think that, because it will enable more voters to get to the polls, despite the fact that they can't, they can't give up going to their job every day. These are the blue collar workers of America that have typically been the stalwarts or strong supporters of the Democrats. So they're looking at all of that. The Republicans, on the other hand, are trying to prevent that. Donald Trump said that the Republicans would never win another election if we had vote by mail. But the coronavirus could change that. And it could make it much easier for Americans to vote. So we'll see what happens there. But in any event, all the experts that I've listened to, and I just listened to some yesterday from Stanford University, the very conservative Hoover Institute on War, Revolution, and Peace, and they warned that, listen, Donald Trump still has strong numbers. He still has strong supporters. They're not giving up on him. And despite the corruption, the girlfriends of his sons are being paid $180,000 each out of campaign funds that were donated by these supporters. Nothing seems to shake their support for him. And politically, we'll see whether coronavirus can do what nothing else seems to have been able to do.
Final question then to you, Jim. We saw last year, Indian Prime Minister Modi went to Texas, and there was this huge Howdy Modi business. The US president comes to India, and there was a similar town hall which was created for him here in Ahmedabad. Do you think, with China becoming this global pariah that you and I were talking about, do you foresee India and America maybe to be getting closer to each other? Is there, in some very brutal ways, does it create a window of opportunity for the two countries? A bigger window of opportunity?
There's always been a window of opportunity some of our, some of our brightest scientists and everyone involved in, high-tech industries have originated in India, and that's not lost on the American people. But there's still problems at the government levels. There's still criticism among human rights groups about, the nationality law and these other issues. Those will remain. That's normal. But I think that the people of India and the people of the United States generally see eye to eye. On this one, on coronavirus, they see what affects you affects me, maybe in a little bit different way, but it still affects me. And I'm interested in what you're doing. And I'm interested to know whether or not that's working. I think the United States has really fallen behind on this one because it shouldn't have been this bad. If we had reacted earlier, it would not have been this bad.
I think those are very wise words. Those are very wise words, insane words, which are coming from you, Jim. Thanks so much. Thanks so much, Jim, for being a part of this broadcast. Always a pleasure speaking to you and trying to figure out exactly what's happening to the world politics and world economy. Thanks, Jim. Thanks so much. Thanks so much for taking time out for us. Well, our other two doctors are still there with us, Dr. Swapnil and Dr. Tripti. Swapnil, now let's look at it from a straightforward, domestic point of view. Look at what the final words of Jim were. His final words were, we simply allowed things to fester on, that we should have gotten into the act far quickly. So I'm asking you, as I look at these figures of Mumbai, as I look at the figures of Maharashtra, is there a fear for you, Swapnil, that maybe the worst is still ahead of us, rather than what we're being told that we may well have managed to deal with the worst?
We definitely haven't dealt with the worst. I mean, there's no question about that. It's going to get much, much worse. And this problem isn't going away anytime soon. It's going to continue for a while. And even when it does go away, it's going to come back as a new virus almost every year, every 2 or 3 years. That's typically what happens when viruses do what's known as a zoonotic jump. So if you look at swine flu or H1N1, or you look at avian flu, all of these viruses, they start in animals, they jump to humans, and they start as a pandemic virus, which means there's a large number of susceptible hosts. And once a sizable percentage of the population develops immunity, they don't become pandemic, they become seasonal. So when there are factors that favor their transmission in the population, they cause a spike in cases. That's what's likely to happen with this virus. But there's a bigger issue here. When you talk about fear, for most people right now, they're experiencing this fear for the first time. I can tell you as a healthcare worker, this isn't new for us. We've been talking about this for years. I mean, we've been dealing with multi-drug resistant tuberculosis, extensively drug-resistant tuberculosis, H1N1, really, really scary infections. And this kind of fear is very normal for us because we never had protective gear. We never had, adequate equipment. And we always had to put ourselves at risk to look after patients. So this kind of fear that people are experiencing now was very normal for others. The kind of fear about not being able to leave your house, not having enough food, not having access to healthcare. These are fears that are very normal for about 70% of the human population worldwide. And when we say we need to scale healthcare, we need to scale testing, you have to put it in the context of we've not been able to do that for the last 3 decades. So it's a pretty big ask to say, develop infrastructure that you have had for the last 3 decades in 3 weeks. That being said, there is a lot that we can do when we come together. You have to remember that it takes one person to start a pandemic.
Yeah, I agree.
When you inverse that, it takes one person to stay home when they're sick to prevent a huge transmission chain. So the individual does have a lot of power to prevent infection of others.
So
everyone needs to work on this together.
Dr. on my Periscope feed, there are a lot of questions which are coming in, and everyone just wants to know answer to one question, which I think, is a valid question, Tripti, which is this: that how far are we from developing a vaccine? Is there a view that doctors in Mumbai have, given the fact that, Mumbai is in danger of becoming the next big COVID hotspot? Is there a view how far we are from developing some kind of a vaccine or a medicine against this virus?
So there are several vaccine trials, some already being tried in the humans, but we need to understand that vaccine trials need to go through the entire phase 3, and it usually takes at least a year for it to be validated, to be proved that it's efficacious, and then to be rolled out. So it's not that we are going to have a vaccine in the next 2 or 3 months. It's going to take a while to get the vaccine ready. And just to answer, talk about a few things that Swapnil said, I agree that this is the time that we really need innovation, and we are a resource limited setting, and we cannot ramp up healthcare system in 3 weeks. So ramping up healthcare system is not always infrastructure. A lot of times it's having very clear protocols. Unfortunately, we face a lot of, we really don't have a lot of clear protocols on quarantining or who is going to be tested. Even at this point in time, when we refer patients, and we've heard this in tier 2, tier 3 cities, there are symptomatic patients with symptoms, but they're not tested. So we understand that, like, his innovation and also about pool testing. But the point is that we need to apply innovation, probably ease out bottlenecks for approving kits or getting more kits in market, procuring kits. We just need to do everything that we can, but we have to ramp it up. So we cannot keep saying that we're a poor country, so how do we do it? We have to do it. We have no other option at this point. If we could afford a economic shutdown for 6 weeks, we have to do this. Otherwise, it's a complete waste if we don't do that. Our economic shutdown is going to be a waste.
Yes, that's my fear. And I'm only looking at all the questions which are coming up on Facebook as well as on Periscope, and there are some people who are logging in on LinkedIn as well. And everyone is simply making one point, which is this, that we've been in this long lockdown period. But Dr. Parekh, what everyone still wants to know is this lockdown, there is a question of economy, which we've dealt with Jim Clancy. But ultimately, are we now in a scenario where we need to make peace with the fact that this virus is here to stay? Is that how we look at our scenario? That this is here to stay, and it'll keep hurting us, and we need to figure some way out of dealing with this virus, like we may have dealt with malaria, typhoid, BCG vaccines, and whatnot. Is that the direction, and is that why treatment of asymptomatic cases is so very important?
This virus is likely here to stay, but we should not make peace with it. We should be aggressively fighting it with everything that we have, every moment that we have. All our brightest minds need to be working on this, human and artificial. So yes, it is here to stay. We don't need to resign to our fate. We can fight this. We should not go quietly into the night. Just to respond to your question, it took 2 days from the time that the virus sequence was uploaded to the NIH in the US that Moderna Therapeutics developed a messenger RNA vaccine. Within 23 days, they had built their first batch of the vaccine. 63 days after they got the sequence, they injected the first dose of their mRNA vaccine into a human subject. There are issues with such an accelerated timeline, but there are issues with everything in a situation like this. But that's unprecedented. To go from sequence to the first human dose in 63 days is unprecedented. The problem with the coronavirus vaccine is something that is a little nuanced, and we see with dengue. It's something called immune enhancement. So when the rate of immune response, the antibodies can lock onto the virus them and actually cause them, enhance their entry into WBCs, and this can worsen the infection. So we need to be really careful about this. This happened with the dengue vaccine in India when we did a trial. And, in my book, I wrote it back in February, but we wrote about all of this stuff and more. There are many, many insights that we put in there that are still not in the mainstream. We wrote about all this stuff in February. And there are, vaccines, when we say 12 to 18 months, we're talking about the ability to deliver billions of doses. But Frontline received a few vaccines, maybe September, October. What Bill Gates did, he did something so brave, about 7 right now. So what the Gates Foundation did is they just put a whole bunch of money and they said, we're going to set up the factory to scale all 7 of these. So we're going to be ready when we find out which vaccine really works, and we'll discard the factories, that didn't work. So when you do innovative things like this, when we know which vaccine works, we're going to hit the ground running in terms of scaling production.
Innovation is the way forward, but more importantly, testing. So to anyone who's thinking that because the number of our cases is doubling, is now the number of days is increasing, that it's 10 days. Well, don't think that the worst is behind us. As Swapnil and Trupti both are pointing out, the worst is most certainly not behind us. Jim Clancy has told us where America suffered, because Americans probably thought that the worst was behind them. Let's not make that same mistake, and let's ensure that we remain committed, we remain as cautious as we are today, right now, in this period of lockdown. Dr. Parekh and Dr. Gilla, thank you so much. Thank you so much for joining us on this edition of Talk to Bhupen. It's a program which is there every night, Monday to Saturday, 8 o'clock, simulcast across all social streams. You can watch this on my Twitter page, on my Periscope page, on my Facebook page, on my YouTube page. Anyone, any comments, suggestions, always more than welcome to take. Thank you so much. Stay well, stay safe.
Bye, take care.
Thanks.